Hi, I'm Cian O'Carroll, and back in 2018 I met Vicky Phelan when she was looking for a solicitor to help her fight her case. She went on to win that case and uncovered a shocking healthcare scandal that has affected so many women and families across Ireland. We also became friends. Vicky went on to fight one campaign after another for women's healthcare in Ireland, and all the time fighting for her own life, fighting for more time. This is a series of conversations where Vicky and I discuss what went wrong in cervical check, how those fatal and life-changing mistakes happened, and look at what Vicky has achieved since she became an advocate for change. Hello again. Once more we're in conversation. I'm Cian O'Carroll, and introduce yourself.
I'm Vicky Phelan.
We're moving on today to look at the history of screening for you personally and how that progressed through to the point of your diagnosis with cervical cancer and then on through your treatment to get a better understanding of that. And it's going to take a couple of episodes, as we're calling them, to cover all of that material. But I thought, Vicky, the handiest place to start was to go back to 1997. You were just 22 or 23 years of age, and you went for your first ever smear.
Yeah, I to be honest, I don't really remember it. I know I would have been still with my family GP at that stage, Dr. Helen Connolly. She's still my mother's GP at home, actually. She's a great doctor. And maybe it was obviously herself who suggested it once I'd gone to college, maybe to go in and just have a smear. Because at that stage, I don't think the rules about age had come in, about having to be a minimum age to have your first smear. So I know a lot of my friends would have had their smears kind of around the same age.
Okay, whereas now it starts at 25 years of age.
Exactly.
Yeah. Of course, you can have a smear done at any time. It's just that the state-funded cervical screening program obviously is free, so why wouldn't you use that instead? And it starts at 25. So
exactly.
that was your first smear, and you don't really remember it, and you went on. I think it seems from the records that I have the advantage of that you were pretty good about going for your smears.
Yeah, I was always very good at following, anything to do with my health and my teeth. I've always been kind of meticulous about making sure that everything was working right and that I was doing everything properly. So, up to that point, as I was going for my smears throughout the years in my early 20s, I never had any issues. I'd always had very regular periods. I'd never had any problems. Like some of my friends would have had issues where they might have a period 1 month and they, mightn't have another period for 3 or 4 months.
Yeah.
Would have ended up with issues like polycystic ovary. I had never any issues like that. So, for me, it was just a matter of, I knew I had to go every 3 years, so I made sure that I made the appointment until the proper national screening program came in and started inviting people in. You kind of had to do it on your own bat with your GP.
And from our point of view, then, I think the last smear test that you had before the cervical check program began in 2008 was actually 2007. And that was your 5th ever smear test.
Yeah, that was it, yeah.
And then we moved on to 2011, and that was your 7th ever smear test, and it was the first one within the cervical check program.
Yeah, so in 2011, I was just after having my son, Dara, in February. I was actually due to have a smear the previous year, but I was pregnant. I did get an invitation from cervical check, but I did contact them to let them know that I was pregnant, and they said that they'd issue another invitation for the following year. So when I went back in 2011, about 4 months after having Dara, so I had my smear in May 2011, it came back with no abnormalities, and I wasn't unduly worried, to be quite honest, because I'd had no issues with any of my previous smears. So, I was told by my GP to come back in 3 years, and I was happy to go off and do so.
And you don't really know anything more about it than that. I mean, you didn't, for example, know that your smear had been sent off to Austin, Texas, in the United States, to be read and interpreted.
No, I mean, I had no idea. I suppose back then it was only because of my involvement in the whole cervical check scandal that I know now that things were far different than what women would have expected, I think. I think if you had asked any woman back then where their smear was going to be tested, we would have all assumed that it was somewhere here in Ireland. I don't think anyone really understood that these were all going to America.
We dealt obviously in earlier episodes with how that came about and the fact that this was really part of a large outsourcing program that seems to have been driven by pricing as much as anything. But during the following years, then of course 2012, 2013 and on to 2014, you didn't know that anything was going on in your body until certain symptoms started to present themselves. In I think 2014 you started to notice bleeding.
Yeah, so, when I think back now, obviously, having been diagnosed, I was wondering, you start kind of looking back and thinking, could I have detected this sooner? Should I have gone to the doctor sooner? But I had no other symptoms. By the time I went in 2014, I went in to my GP in June 2014, and I'd probably been having, a bit of spotting in between my periods, very light spotting for about 3 months. So it had started really in March 2014 for me. Where I noticed something was different. Before that, I can't honestly say that there were any other symptoms that I should have noticed or picked up on. The only other thing that I suppose I look back on now and I wonder, I was running at the time and I kept getting a stitch. I thought it was a stitch, but it was kind of down almost, when I think of exactly, my hand goes straight away to that place. It was almost down my ovaries, you know what I mean, that I used to get a stitch there. I'd have to put my finger on it to kind of keep running. But again, I didn't think that it was anything to do with, you'd never guess, would you, that it was cancer? Anyway, the only symptom I had at that stage was a bit of spotting in between my periods, and the big thing I suppose that drove me to my GP in the end was that I bled after sex. So myself and Jim had sex and I had really a bad bleed and it was very red, and I mean there were white sheets, so you can imagine it was like, a bloodbath had taken place practically. It had been literally, it frightened the life out of me. I'd never seen so much blood apart from having babies. The way you describe it, but anyway,
it wasn't fun at the time.
Yeah, but no, it was not fun at the time. It was very terrifying. Both of us were quite, of course poor Jim thought he'd done something terrible and torn me open or something. I don't know. You just wonder about these things. I really was very, very worried because it was the colour of it too that really made me worry, to be honest, because it was bright red. I just thought this isn't, if it had something to do with your menstrual system, it's always a darker colour. This was bright red, which really scared me. At the same time, I would never have thought. Yeah, that brought me straight into the doctor. That was on a bank holiday weekend, and on the Tuesday I was literally sitting in front of my GP at 9 o'clock in the morning. Because I was so worried that this was not normal.
You had already received your next appointment for a screening smear, but I think your GP arranged for that to be brought forward.
She did. So once I presented myself into her surgery that morning in June, she arranged for me to have a smear straight away that day with the practice nurse who was there. So I did, because I suppose of the type of symptoms that I was describing to her. She knew it wasn't normal and wasn't normal for me, and I suppose the fact that I was giving her so much detail about the colour of the blood, she maybe was already primed at that stage to think that this was quite unusual. So I had my smear that morning with the practice nurse, and even the practice nurse noticed that, when she was taking a sample of the cells, that I bled, again quite a lot after the smear test. So that was unusual as well, and that would have been marked on my file.
It said that you had bled on contact, and then the result came back and that showed that there was a high-grade intraepithelial squamous lesion. So this HSIL result, which required you to be referred on for colposcopy.
Yeah, so literally 4 weeks later, we were lucky, I suppose, back then that there was no such delays like there are now in getting results of smears. So at the time it was a 4-week wait. And I remember being in work actually on the day I got the results, and it was the 2nd of July. It's funny the dates that are imprinted on your brain, but that's one of them for me, I suppose. I remember getting this call from my GP to say the results were back from my smear test and that the changes were very high grade and that she wanted me to come in to talk to her. I was asking her at that stage kind of questions. I still wasn't even thinking cancer, but I thought, well, what's going to happen now? And she said, well, I'd like for you to come in and chat to me. She said, but ideally I want to get you to see a gynecologist for a colposcopy examination. So I went in, I was back home that evening in Limerick, and I went in to see her the following morning, and she explained the results and that they were very high grade, which meant that, you know, further investigation was needed, and that I had an appointment then for colposcopy for 2 weeks' time.
And colposcopy then, it is a type of microscope which is used to examine the surface of the cervix. And you attended at University Hospital Limerick for that?
I did. So I met Kevin Hickey, who was the gynaecologist in charge of the cervical screening colposcopy service in Limerick, and that was my first time meeting him. And he performed the procedure. So, you know, on top of using the microscope, my GP had already kind of told me that I would probably have a LETS procedure on top of the colposcopy. So the colposcopy was kind of, as you said, a microscope, kind of looking further to see if there's anything untoward. And if there is, well, then they carry out this procedure called a LETS. And you know the name of that, so I'll leave you do that.
Oh, it's a large loop excision of the transformation zone. And so LLETZ, the transformation zone is that area on the cervix which they're most interested in, because it's where the squamous cells on the outside start to meet the glandular cells that are on the inside of the cervix. And that's where it changes, where cells are changing. That seems to be a higher risk area for cancerous abnormalities to develop. So they're looking at that area. But once you're a high grade result on the smear, they're mandated to do a biopsy, and that biopsy is normally done by this LETS. So it's kind of a combination of biopsy, and it can be the complete treatment if it's an earlier stage precancerous lesion, as opposed to something which has moved on, as they found out yours had, to become not precancerous anymore, but in fact an invasive cancer.
Yeah, and that's kind of where that appointment was going that day. I suppose I went in that day hoping that I'd have this LETS procedure and that I'd be able to, you know, go on my merry way basically and come back maybe more frequently. You know, I'd been speaking to friends of mine who had this procedure, who talked to me about it and explained what it meant. But again, you know, any of my friends who had the LETS procedure never had to go any further. So I really thought that I'd go in this day and have this LETS procedure and just go back to my normal life. But that didn't happen, obviously. So when Dr. Hickey was carrying out the LETS procedure, he did say to me while he was carrying it out that he was taking away quite a lot of cells, and that I would be quite sore because he was taking away a large area of cells. And that kind of worried me, and that it was going to be longer and that there was more there. You're starting to think straight away, this is not just, going to go away. So then he sat me down when he was finished, and we had a chat, and he basically said to me that he was recommending that I would have a hysterectomy, and that he was provisionally booking me in for the 1st of August, and this was the 15th of July, and like I just thought, at that stage I thought, oh God, this is serious. This is more than just a few kind of rogue cells. So I did ask him the question. I said, are you telling me that I have cancer? And he said, well, no. He said, I'm just not happy with what I'm seeing. You've got a lot of very high grade changes. I had to take a lot of cells away. He said, and I have sent some away for a biopsy. And he said, we'll wait for the result of that. So I remember going home that day kind of with a prescription for painkillers and cramps and sore and terrified really at that stage, thinking, God, is this going to be more than what I think? And at that stage you're still hoping against hope that it's not cancer, that it's all, he got everything. But I remember speaking to my best friend, and she's a nurse, so I rang her that day when I got home, and I explained what had happened. And she said, well, if you don't get a phone call within the next 2 days, or 2 or 3 days, you'll be fine. It means then that there's no cancer. She said, they'll give you the result in 2 or 3 weeks. She said, but if you get a call in the next 2 days, she said, that's it. So I did get the call on the Thursday, 2 days later. And I remember it was about 5 o'clock in the evening. And it was a beautiful day. I remember it being a beautiful July summer's day, getting this call from a number I didn't recognise in Limerick. So I knew, those times when you're looking at the phone and you think, do I really want to answer this or am I better off, not knowing, because things are going to change as soon as you do. But I did obviously answer the phone, and, he didn't really beat around the bush. He just said that he knew, when he was performing the procedure that I had cancer. He could see the tumour clearly. It was quite a large tumour. He said it was about 4 centimetres, and he managed to laser away about 3 centimetres of it. That's why he took so much away that day. But he could not get clear margins, and that was, he said there would have to be further treatment, whether that was going to be a hysterectomy. So what he explained to me then was, if my cancer was contained within my cervix, that I would be a candidate for a hysterectomy, because it meant that the cancer was contained and had not spread outside. So the next step was obviously to keep my provisional booking for the hysterectomy, but he wanted me to go for a scan. So the scan was going to show whether or not the cancer had spread outside of my cervix.
And you mentioned clear margins there, which seems to be quite an important part of the process, that they're looking at the tissue that's been removed in that LETS under a microscope. A pathologist is looking at that, and they're looking to make sure that there is healthy tissue all around the cancerous tissue, and then they know they've got it all. And if those margins aren't clear, well, then the cancer is extending to the edge, and then that you've left some behind, so you have to complete the process, and that's what clear margins is about. You said then that you got word back after that your margins were not clear. You had your scan. The scan results then told you what?
So I had the MRI scan then about 2 weeks later. I think it was the 29th of July. So all of this kind of happened very fast. And on the 29th of July then, I think it was about 2 days after the scan, I got the results of that, and I was brought in then to meet Mr. Hickey, to have a conversation with him about what this meant, whether or not I was going to go ahead and have this hysterectomy 2 days later, because that was booked in for the 1st of August, or whether this was going to mean a different type of treatment. So I remember sitting down, myself and Jim, so Jim came with me for that appointment, and Mr. Hickey said that unfortunately the MRI scan had shown that the cancer was, after travelling outside of my cervix, they could see that I had 2 lymph nodes that were positive, so that they had cancer cells in them. So that meant that the hysterectomy was not going to work, and that now he was literally handing me over to the oncology team at the University Hospital Limerick. So I suppose the minute you hear oncology and oncologist, that was it for me. I suppose that was the start of kind of realising, this is real, this is cancer. I think if I'd had to have a hysterectomy, it would have made it, obviously I would have been cured, but I don't think you see it in the same, I don't think you do anyway, in the same light as in when you go into a cancer centre and have to have treatment. It's just a different, surgery is so much cleaner, isn't it? Whereas once you have to go down the road of having chemotherapy and medication, and it just gets more complicated, and your chances are obviously much lower as you have to go through those treatments.
Although Professor Shepherd, who was the gynecological oncologist who advised in your case, I thought it was very interesting. He was showing the statistics, and that the quality of the radiotherapy and chemotherapy is so good that the prognosis is better when you have that treatment over the surgical option, and it's improving all the time. But you were then referred on, as you said, to oncology, but there were 2 parts to it, isn't it? You had radiation oncology and chemotherapy.
Yeah, so I suppose what a lot of people don't understand, unless you get into that world of oncology, is that there are so many different specialities. So depending on the type of treatment you're prescribed, you are sent to a particular oncologist. So my primary treatment was radiation, so my oncologist was a radiation oncologist. So I had radiation 5 days a week, but I also had chemotherapy 1 day a week. So there's another oncologist that deals with that, so that's a medical oncologist. So I only saw him, once maybe every couple of weeks, just checking in with me, but most of my appointments were with the radiation oncologist. She was the one kind of dictating the treatment.
That's quite targeted, that radiation. So it's external beam radiation, and I think you got your tattoos done for that.
I did, yeah. I never had a tattoo done in my life, and now I have 3 of them. Literally little pink pricks. One on either side of my, on each hip, and one then literally at the top of my pubic bone.
Does your dad mind?
And it's just like somebody got a pen. I don't think I've ever even showed him. Well, maybe I showed him one on my hip, but yeah, that's the extent of my tattoos.
So they're used to guide.
So yeah, they're used to guide the beam basically. So you see it when you lie down on the machine. So you're lying down flat on this machine, and I had to roll down my trousers literally down past my hips, and then you can see them kind of moving the machine until they can line up with the tattoos basically, and that's where they're targeting the radiation.
Okay.
Then. So it's actually fascinating if you weren't a patient,
Yeah.
but at times you're looking at it kind of going, you can see the beauty, I suppose, behind it, the way they can target things now, that it's not all just, blast everything. So
do you feel anything?
Yeah, I had five
when
five
that's
days.
happening? Do you feel anything?
No, nothing.
No.
You don't feel anything when you're having radiation. No, nothing at all. And you're there for, the only thing you feel is discomfort really and that's me. Anyone who has to have radiation down in the pelvic area has to have a full bladder going in. So you have to have drunk, almost a litre of water, and you have to keep it in your bladder. And most people can't hold that much without having to go to the toilet, but you really you can't. You have to hold it, because if you don't, you'll have to wait, fill up again, and go back in, and nobody wants to do that twice. So having to hold a full bladder while you're having this done and stay still is quite difficult, I can tell you. But the reason is they want to move your bladder out of the way, while they're targeting everything else.
Do you hear anything?
No, it's actually quite you can hear the machines kind of going up and down, like a whir kind of a noise, because it's going up and down your body. But that's all really. No, it's all very high tech actually, and very, not very noisy. And you're only lying there for about maybe 10 minutes,
Okay.
and then you're done.
That's your 10 minutes of holding on to a full bladder. What are you giving out about?
You try it.
You then have the chemotherapy.
So my chemo day was on a Wednesday, and that was the worst day of the whole week. And that was always the day that kind of set you up. You knew you'd had 1 or 2 days afterwards of, really feeling awful and staying in bed and terrible nausea. Horrible. So it's a long day. So I used to have to be out in the hospital for like 8:30 in the morning. And I'd get hooked up to fluids. So the first thing they have to do is they have to, they flush through about a litre of fluids through your veins to get your veins ready really for the toxicity that is going to come with the chemo. And then once that bag has gone in, then they put in another kind of smaller bag, and that's literally to kind of coat your veins for the chemo. Because most people who've had chemotherapy, and I only had 5 sessions of chemotherapy, and my veins are still really bad to this day.
Right.
How many years later, I ended up having to get a port in because they just couldn't find a vein, and that's what happens to most patients. So the veins generally tend to just kind of I don't know if there's a word on it, but you can't use them again. So they start with the big ones. So they start here, kind of in your the crook of your arm.
Yeah.
And they try and use those veins first because they're the biggest ones, and it takes less time for the fluids to go in on a big vein. But eventually, after a few weeks, that stops working. So then they start having to go kind of here at the front of your hand. And because they're going to smaller veins, then the problem is it takes a lot longer for the fluids to go through because the veins are that much smaller. And it also hurts a hell of a lot more going through a smaller vein. And sometimes I remember once I ended up having it here in between my knuckles, and I'll never forget the pain. It was so painful. So, it's a horrible experience, to be honest, the chemo day, because it's so long, and you end up, I remember my poor hands. I came out after, you couldn't even move them afterwards. They'd be so sore and bloated. It was almost like spongy bloatedness on top of the hand, and that took a few days to go, and they were black. They would be black for 2 days. And then, you're trying to get back and get ready to try and find another vein the next week. So they went from one arm, it felt like a junkie. I don't know how junkies do it, from one arm to another then, and they'd start up here and then move their way down,
How many different needle insertions would you say were involved in all that?
I remember on one particular day, most of the time, one vein will keep going for the day, but there were times mine didn't, so they had to try and stop and then find a vein, because obviously if the vein stopped working, they'd know the machine would beep, and then they'd realise that the vein was gone, so they'd have to go back and try and find another vein.
Okay.
So this could happen a couple of times, yeah, with me. And some people have better veins than others. I just never had great veins anyway. Starting out, they actually said that to me, because they know when they start, tapping. Some people's veins come to the surface quite quickly.
Right.
Some people's are very deep and quite thin, and mine were deep and thin. So they kind of knew from the beginning that I was going to be a problem, I suppose. So there's always one or two nurses who are really good at finding veins somewhere.
I think we might just pause there, Vicky, because, well, the viewers mightn't realise we've been having some technical difficulties as we go through this, and we're going to try and keep these episodes to in or around 30 minutes. So we might pick up shortly on the next episode at this stage where you're still receiving chemoradiotherapy, and you're moving on then to receiving the third form of treatment, being brachytherapy.
Okay, great.
Once again, in conversation with Vicky Phelan, and thank you very much for giving us this time, Vicky.
Thank you too, Keane.
Hi. Vicky and I hope that you've enjoyed that episode and you're finding the series informative. If there's anything else that you'd like us to discuss or touch upon, please mention it in a comment below. And to be informed of future episodes, hit the subscribe button.